Hello, welcome to another episode of Oh My Menses. I am Corinda, your host. I'm a naturopath, fertility awareness educator, and menstrual cycle lover. Hormones are my favourite. Menstrual cycles are my favourite. I am a certified menstrual cycle enthusiast, at the least. Thank you for tapping or clicking on me today and joining me for the Oh My Menses podcast. As per usual, I always have many an idea to write about. I do send emails. I send fortnightly emails to my Corinda's Corner community. You can join that. What I meant to say was, I always have an ongoing list of ideas of what I can speak about on the podcast. I'm getting new ideas all the time, and I was on a walk. I'm like, okay, when I get home, I want to record a podcast. I had a rough idea of what I wanted to talk about, but then as I was walking, I was getting more and more ideas and I was getting so excited. But it was getting to that point where it was like teetering on like overwhelm, and I'm like, this is the feeling where I'm like, I've got too many ideas. I don't want to talk about anything. And then I got home and I opened Chrome on my phone, and lo and behold, waiting for me in precious divine timing was an article begging for my response. The title of that article was TikTok Birth Control Advice Putting Younger People at Risk, Study Shows. So naturally, I was like, click. And the website that article was hosted on was The Australian, and they were like, log in to read the full article. And I was like, no. So then I searched the headline and found a full article and a link to the study, which was done by La Trobe University here in Australia. Before we get into that, I want to invite you to do a cycle check-in with me. Today I am on day 16 and I am feeling so classically ovulatory. So, sometimes this pisses me off how cliche these cycle phases can be. I am just fully in the 48 hours of ovulation happening. I am just fully in that zone. I haven't confirmed a temperature rise yet, so I'm not confident to say that I have ovulated, but my body is definitely gearing up to that and I'm feeling it. The cervical fluid is present, the mood is present, the confidence is present, the libido is present. I'm out of control. It's chaos in my mind. Welcome to my life. As always, I invite you to do a cycle check-in for yourself. Take a moment to just feel into your body and your mind and your womb and reflect on how you feel, what's present in your body, what's coming up for you, what cycle phase are you in, what cycle day are you on, how is that affecting your current mindset or behaviors. I guarantee 9 times out of 10 the hormones are going to be influencing something on some level. If you are new to cycle tracking, or you want to upgrade your cycle tracking, or you're aware that there is more to track than just your period, but you're not sure where to start, my cycle tracking guide is a fantastic free place to start. The link to download that is always in the show notes. Downloading that cycle tracking guide will also get you into the Corinda's Corner community, where you'll receive my fortnightly emails with access to exclusive blogs and vlogs and archives. Very fun stuff. Now that that's out of the way, let's dive into this article and a couple of prefaces. So I'm a naturopath with a bachelor's degree in health science in Australia. I should note that that is different to a naturopathic doctor, an ND, that you may find in Europe or North America. I'll also say that I have further certification in natural fertility training. I'm a trained teacher in natural fertility education. In addition to that, I have been practicing something called the symptothermal method of fertility awareness, which is a form of natural contraception. I have been practicing that since I was 18. That is coming up to 11 years now that I've been practicing that as my primary form of birth control, my primary form of contraception in the context of long-term relationships, and I have had 0 pregnancy scares. They're the prefaces I want to state. Actually, I'll also state that I have been on a couple of different kinds of oral contraception in my teenage years. I've been on Diane 35ED and Estelle, and I think they're one in the same. Diane was just the non-label brand. What do they call it? When the pharmacist says, do you want the generic brand? That's right, the generic brand. So I've been on the pill. I've experienced that. So with all that acknowledged, I'm sure we're going to comb through a lot more information, and more things and layers of nuance are going to come up as I go through this article. Let's see. And I'll link the article below. Online contraception fictions outweigh facts. Study. This is written by Joe Roberts, fresh from yesterday, the 12th of August, 2025. A study is raising concerns about birth control advice being spread on TikTok and the increased risk of unplanned pregnancy. Apparently, the study shows almost 70% of TikTok users fall between the ages of 18 and 34 years. So a new study out of La Trobe University reveals much of the content is unreliable or of poor quality, putting pressure on young people to discern fact from fiction. That's a fabulous point, and discernment is actually going to be a big point that I want to go into in more depth. Further, the study also shows significant distrust in health professionals among the content creators. That's also a really good point to touch on. Only 10% of the videos that were involved in the study were created by health professionals. The rest came from influencers and general uploaders sharing personal experiences or opinions, or self-described hormone health coaches or wellness educators with significant reach. The study reveals that 53% of the content creators reviewed rejected hormonal birth control, while about 34% expressed distrust in health professionals. The lead researcher, Dr. Caroline Demole-Mandel from La Trobe University, their School of Psychology and Public Health, said that the study results are fascinating but not unexpected. On one hand, yes, I was surprised, but also it was the reason why we did this study. I anticipated that would happen. It's important for GPs to be aware that young adults obtain their information from social media platforms and that information might be untrue. The doctor said that many of the content creators promote natural contraception methods, such as fertility tracking, without mentioning the limitations and variables of such methods, including hormonal fluctuations and partner cooperation. Importantly, they fail to mention that these methods are generally ineffective when used on their own, she said. This kind of misinformation, combined with a growing distrust in healthcare professionals, can result in unsafe decisions and ultimately unplanned pregnancies. A common complaint among the content creators, based on the content reviewed in the study, is not being heard by their clinicians. I think that's really important to highlight. There is this ongoing desire to avoid hormones in your body, to go natural. Then, in a consultation with the health professional, who tends to focus on safety and effectiveness more than anything else, they did not feel heard and sometimes even felt pressured into choosing hormonal options, even if they didn't want to use it. So, personal choices being compromised and even the right to make informed decisions were not there anymore. So it was all about those negative experiences. She encourages GPs to work through that skepticism and resistance from patients during consultations. So when they meet young people, they address those biases and also provide good information about the effectiveness of alternative contraception methods. Young people deserve accurate information to make informed contraceptive health decisions regardless of background or resources. And the last point they make is, from a public health perspective, the fact that those influencers have such a great reach. If we can work together and provide accurate contraceptive education and information on those platforms, I think that will be really good, especially if it's relatable. Okie doke. So that's pretty much the bulk of the article. And there are so many points to touch on. I'm almost wondering if I need to quickly write some dot points of what I want to cover. And I think I might do that real quick. The first thing I want to touch on, which they pretty much opened the article with, was this element of discernment. This element of most young people getting information from social media. This is a fact that we cannot avoid. This is just the way of the current times. It's the era wherein print media is dying, conventional media, the news media is dying. People are getting their information from social media. And with the access that we have in the Western world to not only receive information through social media, but also to share information through social media, means that there is going to be a lot of gunk to sift through online. It means that in amongst really good quality anecdotes or personal shares or good quality information, there is going to be information that comes from a misinformed place or is misleading or is intentionally manipulative. How I relate to life these days and how I navigate life personally is always from a lens of what's in my power. What can I do? And there are some times where I do get quite frustrated at the internet. I get frustrated at the state of it and what's being shared and seeing some things that people share and just thinking, oh my God, that's ridiculous, or that's awful, or that's so wrong, or, whatever it is. Controlling what's posted online is out of my control, is out of our control. Seeing what people are posting on the internet, whether it's right or wrong, whether we agree or disagree with it, out of our control. What is in my control, what is within my power, is the power of discernment. It's the power to consciously consume information, consciously take in information that I read online, anywhere online, but specifically social media, and decide how it feels in my body. Does it feel true for me? Is it sitting right? Does it feel like it's being manipulative? Are there hidden agendas at play? What is the purpose of this thing being shared? Many of us from young ages have been encouraged in so many different ways to either outsource our power to others, or we are lacking trust within ourselves. And so what this, age of information era that we're finding ourselves in calls for is to practice this skill of discernment. That is the power that we'll always be able to come back to within ourselves. And it's going to be subjective and it's going to be tricky territory to navigate sometimes. You're not always going to know exactly if something is true for you or not. You might need to sit with things, reflect on things. And I guess my general advice there is don't take everything at face value. Have an open mind. Question things, especially one of the good markers. And I guess even for me as someone who is currently responding to something that I've seen online to create content, I need to be really mindful of things that spark really strong emotions in me, especially if they're negative emotions. And that's something that I would encourage all people to look out for in their own bodies, in their own psyches, when you are consuming something that you're seeing on social media. If it incites a really, really strong reactive emotion, pause, take a breath, and question what you're seeing. Question it, be critical, get skeptical. Even if the conclusion that you end up with is that you do agree with or believe whatever it was you consumed, whatever information you read or heard, even if that ends up being the conclusion, still take yourself through a process of okay, well, what if this isn't true? What would that mean? How bad would that be? How would that affect me? Just question things, question everything. I think that's something I've been doing since I'm a teenager. Just question everything. And remember, if anything starts to feel weary or anxiety inducing, just remember that you hold the cards. You've got the power when it comes to decisions that you make that directly affect your life, right? Come back to your body. Take a deep breath. That's the first thing. Practice the skill of discernment. The results will be subjective. There are not going to be black and white answers. This is wrong. This is right. Remember that. The second thing I want to touch on is this aspect of many of us feeling unheard by health professionals or feeling a general distrust for the medical industry or among doctors or conventional health practitioners. This is something that is happening. And I think this reflects this move from, again, playing on that power dynamic of this era of outsourcing our power. We've had the era of experts. We've had the era of, we don't know anything about our bodies. Let's just pass it off to the doctors. The doctor knows best. I'll let them tell me what to do. We've also sort of coming out of this era. I mean, we're still well and truly in it, but we've had the revolution of a pill for an ill. We're used to just being prescribed something, an expert telling us that it will fix us or that this is the thing for us to take, this is the thing for us to do, and we're not used to questioning it. I would say, thankfully, we're now shifting, the tide is turning, the times are changing, and we're shifting into this different reality, this different mindset when it comes to our health and our bodies that, maybe we do have more power than we thought we had. Maybe we're looking at our sick mothers or fathers or grandparents or older people in our family, in our friend circles, in our community, and we're going, that doesn't seem right how they're being treated. Or, well, my mum never trusted her body. She's always like questioning what she's doing, or she's always feeling overwhelmed by her health, or, just saying she needs to go see the doctor, or, the gynecologist gives her something, but she still doesn't seem quite right. Like, we're starting to notice that maybe there's more to this thing we call health and medicine. And this is like paving the way for this era of community-based healthcare. Maybe not healthcare, but what I mean is that instead of only looking to health authorities, health experts, people that we see as above us, that people that we see as knowing more than us, we're now going to this era of trusting maybe what people share online about their own personal health journey. We take more interest in people's anecdotes. We might be diagnosed with endometriosis and we might end up watching some vlogs on YouTube about people who have gone through an endometriosis journey, people who are trying to manage it naturally, people who have had a laparoscopy and excision surgery, for example, and how they experienced the system and how they experienced those procedures. And I mean, ask any marketing expert, like social proof counts for something, word of mouth testimony counts for something. So it's not at all a surprise to me that based on our human brains, we find something inherently more trustworthy about someone just sharing their story, someone sharing their personal opinion, rather than looking to this authority that's from one system. We still need to practice discernment in this era, right? But I prefer this era because it's helping us open our minds. It's helping us remember that there are many, many different experiences when it comes to health and the human body and healing. It's reminding us that there's not just one answer that is going to suit everyone. And maybe most importantly for me and my values, it's reminding us that there's more than just one way of treating the human body. There's more than just one medical system, right? Kind of like what I touched in the last episode about PCOS. We just happen to be born in a country where a medical system was chosen, and that lens of looking at the human body and dealing with pathology and the medicines that we use just comes from this like one system that has roots from many different older modalities, right? It's sort of just this very, very specific version, and it's not global. Not every country practices medicine in the same way. It's not universal in that sense as well. And so I like that we're looking to hear other people's stories and opinions, because it's the reminder I think that we all need, that there is more to medicine and healing than just this one westernized, conventional, reductionist view of medicine. It's reductionism versus holism, right? There's two major approaches to medicine and healing, and our publicly funded system and most of our private healthcare system here in Australia at least is made up of practitioners and clinical guidelines and treatments that fall under that more reductionist view of the body, right? Whereas if I'm comparing that to what I do, naturopathy is founded in holism, treating the whole person, looking at our body systems as functioning, as having this constant interconnection, this interrelationship, not looking at symptoms in isolation, looking at the bigger picture and how it's all adding up, including the bigger picture of how we're living, what we're eating, how we're moving, what we're putting on our skin, and how that's impacting our bodies and our systems and our symptoms and our organs, etc. So with that said, we still need to practice discernment even when we're just consuming people's personal stories, right? And we need to remember that Just because something worked for one person, it doesn't mean that it's going to work for us. Just because something went bad for one person, it doesn't mean it's going to go bad for us, whatever the path is that you're looking at. So they're the two things I want to acknowledge straight off the bat. So this is where I want to say, actually before that, the note on feeling unheard and distrustful of practitioners. I'm glad we're having this rise up of women going, actually, not good enough. Actually, your answer is not good enough. Actually, that treatment is not good enough. Actually, I don't believe you when you tell me it's all in my head. Actually, I don't believe you when you say the pill or contraception is the only thing that's going to fix my PCOS, or that's the only path for my heavy periods or my irregular or painful periods or my acne or my PMS or my PMDD. Thank goodness we are waking up and we're going, hang on, there might be more to the picture. I think it's good if we're tapping into our intuition and going, oh, no, I don't like that piece of advice that the doctor gave to me. I don't agree with how they said that or what they suggested to me. I don't like how they dismissed me when I pointed out something to them. I don't like when they told me that my blood tests came back normal, but I feel anything but normal. So the distrust, in my opinion, maybe not in, a public health researcher's opinion, but the distrust from my perspective is a good thing because it's rightly placed, right? I think we can all agree that women are generally being let down by the reductionist Western modern medical system, right? We're left with side effects or unexplained symptoms, unanswered questions. The research on menstrual cycles is really only just comprehensively underway. We're only just getting a real rich understanding of how our sex hormones impact our entire body, when for decades prior in the research, it was mostly men that were studied. Women were being treated with the same medications that were mostly just tested in men or based on findings that were found in men or in non-menstruating females. So the distrust is called for. We're not getting the best results that we could get. The system isn't serving us in the best way that it could possibly serve us. So I'm grateful for this rising up. I'm grateful for this rising of intuition, this rising of collective intuition of women saying, hang on, there has to be more to what's going on in my body. Great. Keep following those nudges, keep following those threads. I'm not even going to say that, yes, you're right, there is something more to what's going on and I have all the answers for you. I'm not even saying that. Just keep following that thread of questioning. If you feel like something's off, if a doctor or a surgeon or a gynecologist or an obstetrician or a midwife or whoever it is tells you something and it just does not feel right in your body, something isn't adding up, something isn't making sense, or you're left dissatisfied, it's okay to question it, and I would encourage you to question it. So I'm here for the distrust. I'm honestly here for the distrust. Okay, now moving on to my point. The article refers to misinformation. The article also refers to the issues with fertility tracking. They also say that these methods are generally ineffective when used on their own. So I want to talk about, in my experience, based on the information in this article and based on stories that clients have told me, how GPs and practitioners in the modern medical system generally view anything natural and anything related to fertility awareness. In my personal experience, I've been told that it's just not a thing. I've heard stories where doctors have said that's a good way to fall pregnant. I've heard doctors say you can't know when ovulation is, so it doesn't work. I've heard doctors say that it's just the calendar method or it's just the rhythm method and it has a huge failure rate. All things like that. So when it comes to public health researchers and doctors and professors interpreting certain information about fertility tracking, they've called it, or fertility awareness online, I have more questions because from what I'm seeing in that world, doctors don't even know the facts. So we want to separate fact from fiction, but doctors aren't even aware of the facts. GPs aren't trained in... I mean, gosh, I've had GPs who seem to not really know what ovulation is or how it works or how it can be tracked. That is not a part of GP training, in Australia anyway. I just don't think this is something that is in modern medical training. So I can't be that surprised when many stories that I hear reflect doctors feeling mistrustful, having their own distrust towards anything natural fertility, fertility awareness, fertility tracking. So it's because of that, and I'm speaking very generally, there could be many, many amazing practitioners out there who understand the power and importance of ovulation and who know that there is a more accurate way to track and confirm ovulation and use that as part of a birth control plan. I like to believe that there are practitioners out there who know that to be true. But for the most part, many practitioners automatically dismiss it. They think it's quackery straight off the bat. And so, of course, when an article and a study like this gets published, it's going to be like, oh, this is a problem. People are going to be having a lot more unplanned pregnancies because... And they're just looking at it from a blanket view of fertility awareness, natural contraception equals not viable. And there's more to the story than that. First, let's get clear what we're talking about. Fertility awareness is an umbrella term that can refer to many different methods of natural forms of birth control. Fertility awareness includes methods such as the rhythm and the calendar method, which I would not at all recommend, and including calculation methods, which I would not recommend. Fertility awareness also includes things like the symptothermal method or the Billings method, which is a cervical fluid only based method of fertility awareness. So we're covering a spectrum here. So let's get specific. There's fertility awareness based methods, and then there are specific methods, right? The method that I teach is the symptothermal method of natural contraception, the symptothermal method. So the first issue is that we can't be just lumping all these things together and speaking about them as though they're the same thing. The failure rates for the rhythm method are going to be exceptionally higher than the failure rates in terms of how many pregnancies occur compared to the symptothermal method, for example, or even compared to the Billings method, for example. So I do want to address the cons. I want to give not the benefit of the doubt, but I just want to acknowledge that, yeah, the fertility awareness methods aren't suitable for everyone, just like hormonal contraception isn't suitable for everyone. Fertility awareness issues, it certainly doesn't protect against STIs, although has my generation forgotten about condoms? Please tell me what you think about condoms and your experiences with men and condom awareness and condom information. I hear too many stories. I get feisty about this. I hear too many stories of condoms just being dismissed or it's such an old school thing. There's jokes or memes about it being condom, isn't she on the pill? And it shits me because STIs are still a thing. Holy shit, STIs are still a thing. You can get HPV from a man. We got to protect our cervixes, And oral contraception or any kind of hormonal contraception for that matter doesn't protect against STIs. It's still a risk, and I feel like that conversation isn't being had enough. Let me know if I'm wrong. Please let me know your experiences with condoms. That made me feel like I'm a really old person. We can't forget the condoms. Won't somebody think of the condoms? So that's my first thing with the fertility awareness method. Doesn't protect against STIs, just like hormonal contraception also doesn't protect and prevent STIs. Fertility awareness involves a diligent level of connection to your body. It also involves upfront training. You need to understand what you're looking for in your body. You need to understand what you're tracking and what the body signs are telling you in order to apply the rules of the method effectively to make well-informed sexual decisions. It does involve, as the article mentioned, it does involve partner cooperation. It's best practice for your partner to be aware of where you're at in your cycle, if you're in your fertile window, if you're outside of your fertile window, what the risk of pregnancy is at any given time that you're deciding to have sexual intercourse. That's something really important, and sort of just important to be aware of regardless of what contraceptive method you're using, I think. A great reason to be cycle aware, even if you're not using a fertility awareness method, for example, you could have sexual intercourse and you could use a condom and you could realize halfway through that the condom's broken. You could be planning to use the withdrawal method and your partner doesn't pull out in time. Like, these things happen, right? By being aware of where you're at in your menstrual cycle, you have a much greater understanding and are empowered with more information for when you do go to the pharmacy and you may want to seek emergency contraception if pregnancy is not a part of your intentions or plan. Knowing how close you were to ovulation, what side of ovulation you were on, helps inform which form of emergency contraception would be better. When I'm saying emergency contraception, another phrase for that is the morning after pill. That's what I'm thinking about here. Equally, if you're aware of your cycle, if you're tracking ovulation and the incident occurred when you know you were well outside your fertile window, maybe you were just about to bleed, you knew you were in your luteal phase, you knew that ovulation was much more than 48 hours prior, your chance of falling pregnant is incredibly limited. I mean, I want to say zero. And so that's just another pro of being cycle aware, even if you're not taking it to the level of fertility awareness. But again, it does require learning, a period of training, a period of trial and error. Most fertility awareness methods can't be applied straight away. Usually there's a minimum time of 3 menstrual cycles of practicing the tracking, practicing the charting, practicing applying the rules correctly while using a backup barrier method like condoms or abstinence before fully relying on the method. So yeah, there's problems with it. It's morning after recording, Corinda here. I just wanted to add in a couple of bits to address specific points that were made in the article as being problems with fertility awareness methods. They mention partner cooperation and they mention hormonal fluctuations. I want to dispel the hormonal fluctuations component first, because really the whole point of fertility awareness and any kind of fertility tracking is that you become aware that your hormones do in fact fluctuate, and that is the point of a menstrual cycle. And if we're tracking ovulation, we are specifically wanting to understand when our hormones are fluctuating to cause ovulation, so then we can make sexual decisions based on how much we want to avoid or achieve pregnancy, right? A part of the fertility awareness method is learning how your body signs, how your physical signs indicate what your hormones are doing, how cervical fluid is reflective of changing estrogen levels, and how progesterone is reflective of having ovulated. So practicing the method is inherently being aware of those hormonal fluctuations, right? The other thing I want to say is that there are add-ons that you can add to most fertility awareness methods that include degrees of actual hormone testing. So for instance, you can add in LH testing. You can get urine test strips, test kits from the chemist, and you would do those tests when you believed you were approaching ovulation, and a positive test would indicate that there has been an LH surge from your brain that is the trigger that causes ovulation. That would suggest that estrogen levels are high enough in your ovaries, ovulation is possible, and your brain has decided, yep, we're ovulating, and you would be able to track that hormonal fluctuation. Something else that I think is more popular in North America is at-home progesterone testing, also through urine testing. So again, progesterone would only show up positive when you've ovulated, because you only make substantial amounts of progesterone after ovulation. So again, that's another way that we are specifically tracking hormonal fluctuations as part of the method, though granted they are just bonus optional add-ons to the symptothermal method. If by hormonal fluctuations they're referring to cases of polycystic ovarian syndrome or any case of like amenorrhea where cycles and periods can be really like long or unpredictable, my counterpoint to that would be that The point of a good fertility awareness method, specifically the symptothermal method, is that you are tracking your daily body signs in real time to interpret your fertile status on any given day in any given moment, right? We're not making predictions based on past cycle lengths. We're not predicting when we'll ovulate based on when we've ovulated in previous cycles. We're not doing that. So hormonal fluctuations, as far as I'm aware, as far as I know, as far as I practice, are not only not a concern, but are inherently part of the method. And I would say a huge component of education and understanding, which ultimately benefits us. When we know more about what our body is doing, we can know when something's off balance or something's going wrong, and we know when to seek help and support if we need it, right? And then the second thing that I want to touch on is the aspect of partner cooperation. I actually spoke about this in the original recording, but I didn't know if I wanted to include it because I wasn't sure if I was just projecting my own opinions. Partner cooperation, they mention as an issue. Yes, to a degree, you need partner cooperation in the sense that you would need partner cooperation in any chosen contraceptive method, and you would need some degree of partner awareness. I would say that fertility awareness methods are maybe more easeful to practice when your partner is on board, when they understand how it works, they understand how the rules apply, they understand the boundaries of your fertile window and what's on and what's not on. But to a degree, I also see it that whoever is doing the fertility awareness practice, whichever body we're being fertility aware of, is the body that holds the cards and can call the shots in terms of, I'm in my fertile window, so it has to be condoms today, or I'm in my fertile window, so we need to abstain, or I'm in my fertile window, can we please do perfect withdrawal? To that extent, it would require partner cooperation, but not impossible to practice the method if your partner didn't understand what was going on, as long as they trusted you enough and they were like, yeah, cool, we're good to go. Now, that's not accounting for the many male partners who I've heard of that can have issues with the method. They might not understand how it works. They might be like, hang on, is this legit? Is this safe? Is this actually going to prevent pregnancy? I don't understand how it works. And absolutely in those cases, it may be best if they get most, if not all, of the training that you would receive as the practicer of the fertility awareness method, just to really understand the science, understand how it works, and understand how the rules apply, and agree upon what you're going to do in the fertile window between the two of you, right? Equally, I would also say that my brain automatically sees this as a contraceptive method that would be easier to practice in a monogamous relationship. But again, you're tracking your fertile status on any given day. So even if you had multiple sexual partners or were engaging in one-off instances or casual sex, again, you can still call the shots. Again, remembering that STIs are still a thing, and I would always recommend condoms with a new partner. My goodness. But you can still call the shots. You can go, okay, I'm going to have sex with this guy today, but I know I'm in my fertile window, so do I want to have sex? Yes, I want to have sex. Okay, so we need to use a barrier method. Okay, condom. So I see partner cooperation when they mention that as an issue. I would say, yeah, to a degree. It's more easeful to practice the method when you have a partner that's on board and understanding of it. I've been lucky enough to have a couple of partners in the past that were very on board with the method, were aware of my fertile window, understood what was on and what was not on in terms of our shared contraceptive goal. That certainly made it a lot easier, but wouldn't have been a barrier for me if they were less involved in my practicing of the method. I still would have proceeded with using that method. All right, back to whatever past Corinda was saying. Let's remind ourselves how the fertility awareness method works. I'll speak to the symptothermal method because that's what I'm trained in. That's what I use for myself. So pretty much in any given menstrual cycle, there is a small window of up to 7 days where it is possible to fall pregnant. It is not possible to fall pregnant outside of these 7 days. These 7 days include the 5 days leading up to ovulation, and those 5 days account for the sperm being able to survive in your reproductive tract in the right conditions for up to 5 days. It's usually closer to 72 hours, but We want to be cautious here, so we extend the window and we go, what's the longest possible time a sperm cell could survive in my cervix, in my vagina, in my uterus, while it's like waiting for an egg to be ovulated. Up to 5 days is the answer. After ovulation, there's a 24-hour window of viability, meaning there's about 24 hours after that egg is released from one of your ovaries in which it can be fertilized, resulting in conception, resulting in a pregnancy. We allow for 48 hours after ovulation has been confirmed to account for the very, very rare but possible event of a double ovulation. This is where an egg will be released from one of your ovaries, and within 24 hours of that egg being released, another egg could be released. This is incredibly rare, but it can happen at all. And again, the fertility awareness method that I'm trained in, that I teach, is one where we are this degree of cautious. We don't go, yeah, you probably just ovulated one egg, so yeah, 24 hours, you'll be good to go. No, we want to make sure that our windows and our margins are nice and clearly defined and well boundaried, especially if your desire for pregnancy is 000%. So 5 days before ovulation, sperm can survive. Ovulation happens. Up to 48 hours after ovulation is when an egg is potentially viable to be fertilized by a sperm cell, resulting in pregnancy. Once you've passed that 48-hour window after ovulation, pregnancy is not possible. The egg is no longer viable to be fertilized, and that's it. So, okay, we ovulate on day 14, so we just do 5 days before day 14 is a no-go zone, and 2 days after day 14 is a no-go zone. No, we can't do it like that, because that's not how our bodies work. We need to understand what signs there are of ovulation so we can track them, we can chart them accurately, and we can go, okay, I can see my body's telling me that we're about to ovulate, and I can see my body's telling me that we have ovulated. That's how you know your fertile window. We don't do guesswork. We don't do calendar-based methods. We don't go, my last cycle was 31 days, so this cycle is going to be 31 days as well. No. There are many stories of women reporting that they've fallen pregnant during their period. And sometimes I see this online being used as a reason to dismiss fertility awareness methods, because they're like, no, you can't just fall pregnant when you're close to ovulation. It happened to me while I was on my period. Many people fall pregnant if they have sexual intercourse during their menstrual period. Couple of explanations for this. One, it's either not true menstrual bleeding, as in you didn't ovulate 2 weeks prior to that bleeding. Bleeding can also be associated with ovulation. So people may think that they had a period and they are having intercourse bang on when they are most fertile, right? Because it's not a true menstrual period. There's also other reasons for uterine bleeding that may appear as menstruation but aren't actually menstruation. And the key point here is just emphasizing how important it is for us as females to seek the education, to seek the knowledge, to seek the answers, and just to be the experts in our own body, because our vaginas and our vulvas and our ovaries and our uteruses and our cervixes do a lot of stuff. And it's really good to be aware of what to look out for to know if something's off balance, to know whether vaginal bleeding is a menstrual period or something else, so that we don't experience these situations based on myths of like, oh, you can't fall pregnant during your period. So I had sex during my period and then I fell pregnant because it wasn't a period, you know? That's another opportunity where we can really take our power back. Menstrual cycle knowledge is an incredible way to rediscover, reconnect with that feminine, that female empowerment, right? Another reason that you may fall pregnant during your period, if it is a true menstrual bleed, is that your body may be ready to ovulate earlier that month. This can happen for a lot of different reasons: illness, stress, change to time zone, traveling to different time zones, and air travel can do a whole lot of things to your brain. And more commonly, I see ovulation being delayed in those cases, but sometimes you ovulate early. And even if none of those factors are in place, you just may be in a body that tends to ovulate on the earlier side. So depending how many days of bleeding you have, your period may overlap with that 5-day window of your fertile window, that 5 days where sperm could survive. You could have sex on day 4 or 5 of your menstrual cycle. Maybe there was bleeding present. Sperm are now in your reproductive tract. And hey presto, you ovulate on day 10. That's within the 5-day window. So they're things to be aware of. If I'm fulfilling my role in helping demystify the menstrual cycle and separate fact from fiction when it comes to something like fertility awareness, I got to add in these layers of nuance, right? So they're the caveats of fertility awareness. Let's remind ourselves what we track when practicing the symptothermal method of fertility awareness. So we know that we're looking for our fertile window. We now understand that there's 7 days within our menstrual cycle where we can fall pregnant. How do we know which 7 days that is? 1, cervical fluid. 2, basal body temperature. There are some additional signs that can help us triple confirm ovulation or give us further indication that we're gearing up to ovulation and that we are in fact in our fertile window. But cervical fluid and basal body temperature are the 2 biomarkers that you need down pat to understand. Cervical fluid will be the factor that opens up your fertile window. The increasing production of cervical fluid indicates that your estrogen levels are rising. Your cervical cells respond to estrogen. Estrogen is literally what tells your cervical cells to start producing different kinds of mucus. The closer you get to ovulation, the mucus changes. The mucus is produced by different cells, depending on how close you are to ovulation. And the closer you are to ovulation, the mucus becomes more fertile. This is a kind of mucus that is more slippery, more wet, has a higher water content, that can look like snot. It can look like mucus that would come from your mouth or your nose. It can also be likened to egg whites, raw egg whites. The function of that slippery mucus is to actually help carry sperm up that find themselves in your reproductive tract. The slippery cervical fluid acts as like a super highway, like there's this anti-gravity pull for the sperm cells. It's quite incredible. If I can find a photo or a microscopic video of that happening, it's quite fascinating to watch. So cervical fluid equals sperm superhighway. So that's the first sign that you look for. Cervical fluid cannot and does not confirm that you have ovulated. It only tells us that your body is preparing to ovulate, that your body is in that zone. The process of ovulation all up takes 36 hours. So it's 36 hours for your estrogen levels to be sufficient enough coming from your ovaries for your brain to decide, yep, all systems go, we can ovulate, and to release a high pulse of luteinizing hormone or LH that triggers ovulation. Ovulation itself is relatively instantaneous. The egg bursting forth from your ovarian wall is pretty much instant, but it takes 36 hours at most for that process start to finish to occur. So cervical mucus covers the opening of your fertile window. Basal body temperature closes your fertile window. This isn't just like taking your temperature normally like you would if you had a fever, if you suspected you had a fever or a cold or a flu. This is a very specific temperature taken when you first wake up after at least 3 hours of consecutive sleep. 3 consecutive hours of sleep, I should say. After you've ovulated, your body will start producing the hormone progesterone in much larger amounts. The function of progesterone is to help your body prepare for a potential pregnancy. Because progesterone amps up your metabolism, it actually causes an increase to your basal body temperature by at least 0.2 degrees Celsius. This change in temperature is trackable through daily and consistent basal body temperature tracking using a specific basal body thermometer. You were able to see your temperatures before ovulation, and then you were able to see how your temperatures increase and stay increased after ovulation. After 3 higher temperatures, that confirms ovulation. And that's how you know, okay, my fertile window has closed. I know that if sperm should find itself in my reproductive tract for the rest of my cycle until I get my next period, there's no chance that I can fall pregnant. Foundations of Fertility Awareness. Who knew this would be a mini masterclass? There you go. So the article and the main researcher in the study, they stress this thing of like, make sure we address the biases that these young people might have, give them good quality information. And I am skeptical because pretty much what I said earlier, I know that doctors generally mistrust anything labeled fertility awareness adjacent. They don't believe that it's a viable form of contraception. That's a good opportunity to say that the symptothermal method of fertility awareness, when practiced in perfect use, there's typical use and there's perfect use, is 99.6% effective at preventing pregnancy. That means with perfect use, 0.4% of users will experience a pregnancy in the 12 months of practicing that method. 0.4% compared to 99.6% who aren't falling pregnant and who the method is working effectively for. That's a good statistic to remember. But I'm sure a lot of doctors don't know that. So I'm skeptical that this will almost just influence the marketability of contraception conversations in doctors' offices, making hormonal contraception just more marketable and appealing to this younger audience who is informed differently around health because of their social media consumption, right? And their social media exposure. I would love a world where the outcome of this study is that good quality fertility awareness method information enters doctors' offices and it is preached as a thing that, yes, this can work, but here are the cons and you need to be trained in a method. Here's our directory of fertility awareness trainers. Go talk to Corinda. That would be a great outcome, but I don't believe that will happen. I believe the focus will be on turning people away from anything that is natural fertility awareness based, and easing concerns around hormonal contraception. Let's remind ourselves of the cons of hormonal contraception. The side effects, for one, the side effects are probably the most obvious thing. Women not feeling like themselves, women feeling depressed, libido being affected, weight gain, brain fog, changes to mindset and mental attitude, changes to energy levels, increased incidence of developing thrush, changes to the tissue of your vulva and vagina, dryness of the vagina. They're sort of at the least. We also know it's possible at all that depending on the kind of hormonal contraception, some females can have psychotic breaks. It can be the trigger to bipolar disorder or schizophrenia or the symptoms. It can be responsible for the symptoms of those psychiatric disorders amplifying. It's a thing. It's a thing. Don't shoot the messenger. It's a thing. This happens. We know that progestins and progestogens, which can be found in many forms of hormonal contraception, which aren't the same as your natural progesterone that you produce after ovulation, that cannot be overstated. There are links between these compounds and various tumor development and cancers. Julie just messaged me today actually about a podcast listener who shared their story about a meningioma after they listened to our episode of the Nuanced Naturopaths, where we went through the link between Depo-Provera and a higher incidence of meningiomas, which is a kind of nervous system tumor. And that prompted me to look over the research that we covered on that episode and this isn't a secret. You can find links between various hormonal contraceptives and endometrial cancer, ovarian cancer, breast cancer, these meningioma tumors. It's a thing. And cancer's a big word, cancer's a big claim. But, if we're really thoroughly looking at the potential downfalls of medications that happen to be very effective at preventing pregnancy, we need to look at all the downfalls. We need to look at every possible consideration. If we're striving for an era of true informed consent and patient-centered care, our patients deserve to have all the information before making a choice as to whether they put something in their body or not. So I just want to put that out there, and I'll link some papers below that you can read. The biggest other con that comes to mind is the shutting down of the menstrual cycle, which also isn't often explained to patients who are starting any kind of hormonal contraception. Periods, bleeding that you experience on these kind of hormonal contraceptives are often described as a normal period. You're just told that it's more regular or that it will be lighter than your previous menstrual periods. This just isn't the case, unfortunately. And the result of the shutting down of the menstrual cycle is changes to your estrogen levels and changes to your progesterone levels. What we're learning, what the research that's, again, only emerging because it's been for so long, academia did not prioritize the study of menstruating bodies. The research is showing us that estrogen and progesterone are more than just sex hormones. They have a profound impact on various neurons and receptors in our brain. There are estrogen receptors found pretty much all over the body. We know that estrogen is crucial for for healthy bone development and osteoporosis prevention. We know that progesterone can be protective against so many different symptoms and conditions. Most cases of premenstrual syndrome and premenstrual dysphoric disorder, there's usually some degree of progesterone deficiency at play. Progesterone primes our immune system, as does estrogen. Estrogen and progesterone, they're like two umbrella compounds. There are so many metabolites that come from these hormones, and they have such a profound impact all over our body. The link between estrogen and the protective impact of estrogen on our cardiovascular health, reducing our risk of atherosclerosis and severe cardiac events. This is a thing. We know this. Again, I'll link some research in the show notes. So especially when we're putting young women on hormonal contraception just for the goal of pregnancy prevention, we really need to consider all the risks and the impact on future fertility as well. You may see it referred to as a kind of post-pill PCOS, post-pill PCOS, where after any length of time on a kind of hormonal contraceptive, it can take months or years for someone to get their normal menstrual cycle back. That is a devastating amount of time for someone who is trying to get pregnant after years of preventing and avoiding pregnancy, right? The point is, our menstrual cycle has a purpose. Our hormones, our sex hormones, are there to support us. We need to consider what happens when we shut down that cycle and when we turn the dial down on those hormones, as well as the impact of what happens when those analogs to those hormones, what these contraceptives are made from, these synthetic hormones. We need to also acknowledge the impact that that's having in our body as well. There, in a nutshell, I would say the cons of hormonal birth control, and also in a nutshell, the benefits of our real hormones that get blamed for so much. And something that I say a lot on my own social media is the function of our hormones as chemical messengers, and so much more than that. The more I learn about hormones, they are so much more than chemical messengers, but it is one of their primary functions. Often, symptoms and conditions that get blamed on hormones are actually just a demonstration of our hormones responding in an appropriate adaptation to something that is off with our environment, or something else that started the ripple effect onto our hormones and our periods. Usually there is stress that precedes a change to hormones. There might be an exposure to an environmental toxin. You may be exposed to that thing for years and years and years with no problems, but sometimes these things accumulate in our body, or our immune system's response to these toxins, or our liver's capacity to efficiently detoxify these substances starts to get compromised as we age or based on other factors. You know, our bodies can catch up with us. So with hormonal conditions that are often treated with contraceptives like PCOS, like endometriosis, like premenstrual syndrome or PMDD, the hormones aren't at the root of these conditions. So by giving a hormonal contraceptive that turns off our natural hormones, we're not treating the root cause. We're just putting a band-aid on a wound that is profusely bleeding out. Can you hear my voice is changing because I'm talking so much and so passionately? Menstrual cycles are important. Fertility awareness encapsulates a lot of different things. When you're consuming information online and stories online that refer to fertility tracking and fertility awareness, just add in the layers of nuance. Don't trust content creators or health influencers or self-proclaimed hormone health coaches. Don't trust them to add the nuance for you. Make the effort for yourself because you deserve it and your body deserves it. Make the effort to seek the knowledge that applies to you. Ask mentors, seek the wisdom, do the research. Ask people that you trust for their opinion and add in those layers of nuance as you're consuming content. So if you see, for instance, am I happy to call it out? They've known to be litigious. I'll say there is a company, a company that produces a device that pairs with an app, and it is, I'm pretty sure it's an FDA approved contraceptive device. This device measures your basal body temperature. Yay, excellent. We know the importance of basal body temperature when it comes to practicing a fertility awareness method. The issue is that this device and this app doesn't speak to the importance of cervical fluid tracking, which, remember, opens up your fertile window. It's only taking in the second half of the equation, which is basal body temperature, which will raise after you've ovulated. Remembering that you can fall pregnant before ovulation. So this is a great example of a acclaimed popular product being supported by health professionals and health influencers specifically on social media. And it's also FDA approved as a contraceptive device. And even that is flawed. And now that you've listened to this podcast, you can, next time you see an ad for it pop up on your Instagram scroll or you see someone talking about it on TikTok, you can say, yeah, that's cool and all, but you need to make sure that you're aware of fertile cervical fluid before your temperature rises. Because this app, this device will give you safe days to have intercourse, saying, oh, yep, you're good to go, you can't fall pregnant. But this device and this app cannot track your cervical fluid for you. This app does not know if you have fertile fluid in your cervix, in your vagina, at your vulva that would support the survival of sperm for up to 5 days. Just saying. We got to be aware of this. Whether it's a super dodgy influencer or whether it's a full-on company that has lots to spend in marketing and advertising. Add in these layers of nuance yourself. If you are interested in more information, I teach patients the fertility awareness method, specifically the symptothermal method of fertility awareness, in my Welcome to the FAM journey. FAM stands for Fertility Awareness Method, in case you missed it. And look, I don't even want to say that you must learn this from a teacher. I didn't have a teacher when I first started. I was 18 years old and I had a big old book and I was watching health influencers online and I was using a combination of my keen interest in biology and sexual health, plus my diligence with reading this book that told me what to track and how to track it and how to apply the rules correctly, plus what health influencers were saying online about their own experiences. And with that combined, I have been practicing this method without any pregnancy scares. Because also with this method, by confirming ovulation, I know when my period's going to arrive. So I'll be the first one to know if my period's late. it's not going to be like a week after it's due and I'll be like, hang on, where's my period? No. I know when it's coming to the day, because that's how this works. That's how this kind of information works. This is the kind of information that you have access to. This is the kind of information that we all have access to. It's just a matter of diligence and practice and a little bit of patience while you're learning it. So I believe this is something you can teach yourself with the right mindset, with the right attitude, and with the right application of yourself. If you would like my recommended resources to get started on that journey, let me know. Otherwise, you can check the links in the show notes to learn more about my Welcome to the Fam journey, and if that might be something that is a match for your contraceptive or pregnancy prevention goals at this time in your life. Equally, this is also a method we can use to increase your chance of pregnancy. The great thing about learning how fertility in your body works and how to track it is that you can use the information to try to have sex, to try to have a baby, or you can use the information to know when to avoid sex or when to use another contraceptive method to avoid pregnancy. It's fabulous. How versatile. That's incredible. If you appreciated this episode in any way, if this was helpful to you at all, I would love if you shared it with someone who you think it would also help. Additionally, if there was something insightful or useful, or you just enjoyed watching or listening to me, I would appreciate a like on whatever platform you're watching this on, a rating and review on Spotify or Apple Podcasts, or a subscribe on YouTube. Every little click and engagement helps this information become more widely available to people who could genuinely benefit from it. I thank you so much for doing that. Again, free resources, free cycle tracking guide, link to that below, Corinda's Corner email, and exclusive blogs and vlogs, also linked to join that below. Stay informed, question everything, keep in touch with your intuition, check in with your body, check in with your cycle, your body is wise, hormones are a critical messenger, etc., etc. Don't believe everything a doctor says, don't believe everything a health influencer says. All right, I think that captures it all. See you guys next time.